Google has rocked the medical industry with its Articulate Medical Intelligence Explorer, also known as Amie. What's surprising, and perhaps frightening, is that Amie can defeat medical professionals at their own game. This groundbreaking AI is not only capable of carrying on rich conversations, as many recent LLMs are, but it has also been optimized for holding physician-patient conversations. In other words, an AI model has been shown to be good at including diagnostic reasoning within those conversations. So, in this video, we will be looking at what exactly Amie does, just how good the AI is, and how Amie could change the future of the medical sector. Before we dive in, this is a good time to subscribe to the channel. We share valuable videos about the ever-growing AI space regularly, so go ahead and click the notification bell as well so you don't miss a beat. Google AI has achieved a significant milestone by introducing Amie, the first AI ever created with the ability to converse medically and solve medical puzzles like a professional detective. This research, published on January 11th, represents a turning point in the field of technology and healthcare. Clinical research scientist at Google Health, Dr. Alan Karthikesalingam, sums it up nicely when he says that Amie represents a paradigm shift in medical AI, pioneering a path for AI to engage in nuanced conversation and extract crucial medical insights. Amie was built on one of the pillars of medicine, a physician's ability to build trust and connect with patients. Ideally, medical professionals must be able to skillfully communicate with patients to be able to build trust and empathy and diagnose as accurately as possible. Large language models, known as LLMs, can strategize, analyze data, and come up with reasonable conversations. But in medicine, this is not enough. A proficient medical professional must find out about a patient's medical history and ask targeted questions if they must provide a differential diagnosis. It is one of the most important things they learn at med school, and it takes a lot of time. Other companies have also been on the move to develop AI systems capable of holding diagnostic dialogues, but they have all hit a major stumbling block, closing the gap between AI and physicians' expertise. And this is where Amie comes into play. In Google's words, Amie is a research AI system based on an LLM and optimized for diagnostic reasoning and conversations. Translated into more simple language, what they are saying is that the Articulate Medical Intelligence Explorer is an LLM-based AI that can carry a conversation with patients and predict what their diagnosis could be. Google has fed Amie with several dimensions that simulate real-world consultation experiences from the views of both patients and medical experts. Amie also has a set of automated response systems to diagnose several diseases and incidents. To begin with, the AI finds out the patient's medical history. This feature allows Amie to paint a clear picture of the patient's health status. Then, it comes up with several prospective diagnoses, as well as their chances of being the real deal. Next, Amie engages the patient in a back-and-forth conversation to increase its understanding and narrow down the list of possibilities. After that, Amie will share its conclusion in an easy-to-understand manner, providing the reason behind its findings. For example, let's say you have a headache and you consult Amie for medical attention. First, the AI physician will go through your clinical history to draft out possible reasons why you might be coming down with a headache. Then it chats with you to shortlist the possible reasons why you have a headache. Once that is done, Amie will tell you the final possibilities that remain. Amie wasn't easy to bring to life, and its creators had a challenge when it came to finding real-world medical conversations to feed its eager AI brain. However, co-author of the paper and Google researcher in artificial intelligence, Vivek Natarajan, wasn't going to let it deter them. Thus, they managed to get Amie to initiate self-talk. Imagine it as a kind of medical improv theater. Initially, they sent real-world data, such as medical records and real-world conversations, to Amie. Amie was then asked to share symptoms and pose inquiries while acting as a patient and also as a doctor. Additionally, they assigned Amie the role of the critical coach, analyzing the doctor-patient dialogue and providing suggestions for growth. During this conversation marathon for self-training, Amie continued to learn and improve. Every conversation turned into a building block that improved its comprehension of medical complexities and improved its ability to communicate like a doctor. Pretty smart, right? Observing a budding artificial intelligence become proficient in medical knowledge is similar to witnessing a child learning through role-playing. Who knows? One day, Amie may be the one teaching actual doctors and assisting them in refining their diagnostic and bedside manners. That's a fascinating thought to think about. It's difficult enough to build an AI that needs to evolve constantly, and even harder to do so in the vast field of medicine. Besides, how do we know Amie is the real deal, and not some AI that simply makes guesses? This prompted Google's researchers to come up with some super innovative ideas. They took this head on, taking ideas from conventional methods for gauging communication and real-world consultation abilities. First, they created a thorough assessment tool that broke down diagnostic talks into important categories, such as obtaining medical history, making accurate diagnoses, and even being kind to the patient. Imagine a sophisticated, high-tech scorecard that carefully scores every aspect of doctor-patient interactions, including clinical reasoning and empathy. Furthermore, they designed a randomized, double-blind crossover study to test Amie. Think of it like a blindfolded duel. Actors simulated patients in text-based consultations, communicating their symptoms to both Amie and experienced physicians. The text chat approach is an interface many patients would currently be familiar with, and it mimics the well-known landscape of large language models. What is so interesting about this test is that it simulated the demanding nature of an objective structured clinical examination, or OSCE, a standardized evaluation for medical professionals. Similar to these hands-on assessments, the consultations covered a variety of scenarios, each of which presented a challenge for Amie and the medical professionals to diagnose and treat accurately. The researchers tested Amie's diagnostic abilities against 20 primary care doctors to get a true sense of its effectiveness. They conducted the blind test using identical text-based consultations and simulated patients with various medical backgrounds. Expert medical professionals and the patients themselves evaluated Amie and the human doctors, resulting in an intricate assessment. Notably, this investigation was not designed to replicate the details of a face-to-face medical consultation or typical text communication practices employed by physicians. Rather, it tried to mimic the way users often communicate with language models via text chat. This well-known and scalable method may be the way that AI is used in remote medical conversations in the future. Amie not only met, but exceeded expectations when placed against primary care physicians in a mock diagnostic battle. After a thorough assessment, it was discovered that Amie's performance was often higher than that of human doctors. This outstanding achievement was evaluated on several important aspects of effective consultation, such as how it obtained medical histories, the precision with which it made its diagnoses, and even its ability to communicate. Indeed, Amie received higher ratings on a staggering 28 out of 32 evaluation criteria from specialist physicians and 24 out of 26 evaluation points from patients themselves. These findings imply that Amie is more than just a conversational robot. Rather, it has the potential to revolutionize the field of medical diagnostics. Amie's performance is certainly encouraging, though the researchers are wisely recommending we all proceed carefully when interpreting the results of the study. There are restrictions on the study's design. Selecting text-based consultations over in-person contacts is sensible because it allows for greater scalability with LLMs. However, it may also minimize the importance of the human dynamic in actual healthcare settings. Furthermore, this research is only the beginning of a lengthy road. More work is needed to turn the research prototype into a trustworthy clinical tool. Performance in real-world scenarios, health equity and justice, protection of privacy, and a host of other factors are all critical issues that must be addressed to ensure the safety and reliability of the technology. It will be possible for Amie to be responsibly included in healthcare in the future if these restrictions are addressed. The chatbot's journey toward practical deployment is still a marathon rather than a sprint, even with its remarkable grasp of medical reasoning and communication. In the future, Amie might revolutionize healthcare, according to the researchers, but with significant restrictions. Dr. Adam Rodman, an internal medicine specialist at Harvard Medical School, acknowledged the tool's potential value but stressed the need for human interaction in healthcare. Medicine, he said, goes beyond just collecting data. The human relationship is at the core of it. This point of view emphasizes how important empathy, trust, and advanced knowledge are. qualities that are still reserved for experienced healthcare providers. As a result, Amie promises to strengthen medical professionals rather than take their place. Amie might free up valuable time for doctors to concentrate on developing those important human connections by managing repetitive activities and aiding in diagnosis, ultimately resulting in a more comprehensive and patient-centered care experience. Overall, Amie looks promising, which isn't that surprising given the pace of AI and seeing how much we have opened up to the idea of AI systems over the past couple of years. Remember to like and subscribe. Thank you for watching.